Welcome back. I told you earlier that we'll be talking about glaucoma today, and I have an optometrist right here with me. She'll be telling us a lot about this particular eye defect. Well, her name is Dr. Uloaku Kola-Olalere. She's right here with me. Good to have you join us today.
Nice to be with you again. Thank you for having me.
Absolutely. So when we say glaucoma, what exactly are we talking about?
Wow, glaucoma, like one of the big ones. So glaucoma is a progressive eye disorder that is caused by a damage of the optic nerve, and then of course resulting in irreversible loss of vision. So you see that I emphasize on certain words: progressive and irreversible.
All right, why is that so?
Well, irreversible because whatever vision is lost by glaucoma is lost forever. It cannot be restored, it cannot be reversed. So glaucoma, as we know, is one of the leading causes of irreversible blindness in the world.
All right, what are the causes? I think we should start from there.
As with some of the other eye conditions or eye disorders, glaucoma has no known cause. What we know is that there is damage to the optic nerve by increased pressure, and then the cause of the increased pressure is not something that the viewers want. It's something that is studied in school, right? So, but there's increase in the pressure in the eye, of the eye pressure, and then this increase in pressure results in damage of the optic nerve, and then we can say that the person has.
I don't know. As an inquisitive person, I might be wondering, when you say pressure, what's this pressure about? What's the pressure doing in the eye? What's the function of the pressure?
Well, every eye has what we call intraocular pressure, and there's a normal range for the intraocular pressure. That's the pressure of the fluid. That's, like I said, the process or the physiology of it is what's something that was studied in school, and to be too cumbersome for our viewers, right? But we know that there's a normal range of the intraocular pressure. And then there's a point where if it goes above normal, it becomes problematic. So then we say that the person, of course, when the pressure is measured with other examinations that will be done, we can now diagnose the person and say the person has glaucoma.
All right, risk factors?
Risk factors. Age. So glaucoma mostly affects people of a certain age. Once people are 40 and above, they are at risk of having glaucoma.
What's with 40 and above? I mean, a lot of things you hear 40 and above, 40 and above.
40 is like the age of wisdom. Well, you've entered the middle age. At 40, so many things changes for women. So we find that many geriatric conditions start at 40 and above, and of course they say life begins at 40, but that is when everyone needs to start paying attention to so many things that concern the health. So age, being of African race, so the Black Americans, the African, just being Black is a risk factor. People who have certain conditions like hypertension, or people who are hypertensive, people who are diabetic may also be at risk of having glaucoma. People who have had certain traumas may be at risk
of the eye or the head.
Yes, the trauma that's people who take certain medication may also be at risk of glaucoma. Pretty much.
All right, I'd like you to probably highlight some of these risk factors. Talking about some medications, talking about hypertensive. I know to a very large extent. I think that's a given to a very large extent.
So the thing is that when we're talking about age, I don't even think we need to wait. Okay, I missed one. People who have a family history of glaucoma are at very high risk. So if, for example, someone's grandmother presents with glaucoma and is being managed with it, the person, all the people that are in the generation of that grandmother should actually start getting themselves examined. Well, we say from age 40, it should actually be earlier than that, right? But we believe that at 40, symptoms and signs begin to manifest. The problem is that people wait until these symptoms become so bad. And it will interest you to know that many people for glaucoma don't present until they have lost their vision. And remember that I said it is the cause of irreversible. Now, when you're coming, a significant part of the vision is lost.
And that's not
There is nothing that we can do to get it back. So they come, they've lost what they have lost. They just need to manage what they have until it's time for them to leave the planet Earth.
Now, I also remember you talked about being progressive. So does this mean that irrespective of when you start treating, it will keep progressing?
Well, so for glaucoma, it progresses if you don't manage it at all.
If you do not manage it, but if you do manage it,
you
can just stop where it is.
Yes, you can just cap the progression and it doesn't go beyond. So I'm trying to look for a practical way to, let's say if this is where we're at when you show up, right, and then you start taking medication, the appropriate medication for it, glaucoma may not go beyond that point. Even if you've lost this amount of vision, it may not go beyond this. But we find that most people come when it's significant.
Why would someone want to wait that long when you're already feeling something?
Well, there are people that when you speak to, they always consider the monetary factor, or they say that healthcare is expensive. And I say to those kinds of people, would you rather you lost your vision, which is more expensive to manage, right? Because if you lose your vision and you're within a working age, you can't work anymore.
I think that speaks to poverty in the land and how that will probably need government to intervene.
You can't work anymore. You can't earn a living. So it is better we nip it in the bud before it takes the vision away. And then when we say progressive again, I would like to state at this point that glaucoma takes away the vision peripherally. It starts from peripheral loss of vision. So we find that your visual field begins to go gradually until it leaves one with a tunnel vision. The tunnel, once the patient gets to the point where they have the tunnel vision, that is like the end stage where you can't, when you're seated, your visual field is wide. You can at some point and then you can see things. That is part of the gift that the eyes give to us. But glaucoma steals that away from us. And we also say it is a silent thief of sight. What I mean by that is that it takes away your vision without symptoms.
I was going to ask you symptoms, but now I think you're just saying it.
Without symptoms. Glaucoma doesn't show up with symptoms, even though there is a type of glaucoma that comes with symptoms. But most people who have glaucoma that doesn't show up with any symptoms.
When you say, let's look at this, you said it's progressive. And now you're saying it doesn't have symptoms. So what happens? How does it, is it overnight all of a sudden it becomes a tunnel vision?
No. So it is progressing. The vision is gradually being lost, but people are not paying attention.
So very quickly, let's look at prevention. Is there a way we can prevent it? Well, with the risk factors, you know that, okay, what you can probably do is present as often as possible, especially if you have the history.
Sure. The only way so even showing up is not preventing.
Okay.
Because if it runs in your family or there's a family history of glaucoma, well, the chances of one getting it are there. But showing up means early diagnosis and management starts on time. So I think, that is the best prevention. But for saying that if someone who will get it will get it, really, but to show up on time and then we can manage it, of course. And once management starts, irrespective of the age, it's management for life. Okay,
now that you've said it's management for life, how does it feel living with glaucoma? What are the things that, for someone who's living with glaucoma, what are the things the person should do?
Primarily, keep to appointments. Make your doctor your friend. You can't miss appointments. Do not miss out on your medication, really, because missing a day or two might not really be very nice. When you start skipping medications, you miss 1 day, you miss 2 days, before you know you're missing 1 week. And then of course the medication is not as effective, or the eye drops are not as effective, whatever it is, whether it's oral or topical, is not as effective as it should be. So don't skip medications, don't skip appointments, and you'll be fine.